Thank you very much, and good afternoon to all. Thank you for joining this webinar. So today we are going to talk about vaccination in developing countries, challenges and solutions. And we will spend the next hour or so talking about the importance of vaccinations in countries like India. We'll also talk a little bit about the challenges that vaccination at this scale imposes and some solutions. And then towards the end, I will also touch on a little bit about what Helaman Labs is doing to address this problem. So to kick off, we will start with some facts about vaccines and immunization. First and foremost, I'd like to say that vaccine is a huge opportunity. In terms of the amount of money that vaccination saves, this number runs into billions of dollars. The burden and the impact of not vaccinating our children is also enormous. By some estimates, each year we lose 25 million children because we're not able to vaccinate them. The good news is that if you look at the history of vaccines over the years, mankind has been able to eradicate diseases like smallpox, and we're almost at the verge of eradicating polio, with the exception of perhaps 2 or 3 countries. We have very effective tools available to us in terms of simple, safe, and effective vaccines. The even better news actually is that as time goes by, the cost of procuring these vaccines, the cost of immunization also is going down. And that is reflected by a number of vaccine products that have become more and more affordable over the years. And yet we know that there are some challenges, and we'll talk about those. So to get into some specifics as far as introducing the topic, first I'd like to say that infectious diseases are a major cause of death and disability in children and also in adults. And in small children, children less than 5 years of age, this disability and deaths mostly is around enteric diseases and also the infections of the lower respiratory tract. We do have a number of interventions that are available, improved sanitation systems, clean water, etc. But it's obvious that over the last 40+ years, those tools themselves actually have not been helpful. And we need vaccines as well, and that's where the importance of this topic comes in. So we have important tools available, and these tools, when used in the right way, can make a huge difference. What is really needed is not just the utilization of these tools, but also more investment in R&D that is needed. Now, the reach of vaccines in developing countries is quite substantial. As I mentioned, as mankind, we've actually successfully eradicated smallpox. There's been a very dramatic reduction in the incidence of diseases like measles over the past several decades, and we're almost at the verge of eradicating polio, with the exception of maybe 2 or 3 countries such as Nigeria, Afghanistan, and Pakistan. And yet, despite these developments, there is an urgent need to reach all the children across all geographies. And unfortunately, by some estimates, 1 in 5 children worldwide is not adequately protected by the most basic vaccines, and that results in a very large number of unnecessary preventable deaths in the range of 1.5 million children that die each year because of vaccine preventable diseases. Now, the good news, as I mentioned, is that the reach of vaccines in developing countries has actually improved quite substantially. And if you look at the graph that is being shown on your screens right now, you see some very interesting trends. If you look at the bottom of the graph, you see vaccines for diseases such as polio, DTP, measles, tetanus, hepatitis B, and so on and so forth. And what you see is that the worldwide coverage in terms of vaccines for these diseases is actually quite high, in the range of 80% or higher. But progressively, as you start looking at newer vaccines that have only been available in recent years, so things such as pneumococcal conjugate vaccine or rotavirus vaccine, here you see that the numbers drop very sharply. So we are actually less than, let's say, 50% in some cases, and less than 20% coverage in the case of rotavirus. So the point here is that with established vaccines, older vaccines, we're doing pretty well, but where we are not doing well is in the introduction of new vaccines. And we need to solve that problem, because at the end of the day, when a child dies, it really doesn't matter whether they die of measles or whether they die of rotavirus. It is ultimately a death that can be prevented. This slide here talks about the burden of unimmunized, non-immunizing our children. So we're talking about more than 30 million children around the world that go without immunization. And I think the striking statistic that is shown here in this slide is that of all those children who go without vaccination, 60%, so 6 out of 10 children, live in just 10 countries, of which India is one. So what this tells us is that we need some focused, targeted approach, not just in the developing countries, but even within the developing world. There are some countries that represent the lion's share of this unmet need, and so we therefore need to do a much better job in those countries. I mentioned that when you look at children less than 5 years of age, the big burden of disease is due to enteric diseases. So these are diseases that are spread through contaminated food and water through the oral fecal administration. This particular cause of death and morbidity is quite high across the world, and you see some statistics here in terms of the number of deaths. The disability adjusted life years is also very high. There are a handful of pathogens that are collectively responsible for these diseases, things like rotavirus, ETEC, Shigella, Campylobacter, Salmonella, and others. In the developing world, we have contaminated food, we have contaminated water that is responsible. In the developed world, also these are foodborne illnesses that spread amongst children and also amongst travelers that travel to these countries. This is an example of rotavirus, and you can see that if you go back about 10 years or so, 2006, 2007, the use of rotavirus vaccines across the world was actually quite low, and the burden of disease was very, very high. A very large number of children died unnecessarily because of rotavirus infection. What you see over the years, of course, is that the use of rotavirus vaccines has increased quite nicely, although there is much more work to be done. And as a result of this increase of the use of vaccines, the number of deaths is actually reduced quite significantly. We obviously need to do a much better job at this. Here's an example of cholera, which is another enteric disease spread through contaminated water. And what's interesting here is that if you look at the world map and you look at the blue areas, and that's where cholera is endemic, you find that there's only specific regions in the world. For example, Sub-Saharan Africa, you see parts of Asia, India, also the Bengal Delta, Bangladesh, and some of the neighboring countries where the incidence of cholera is very high. The problem with diseases like cholera is that they can spread very quickly from one place to the other. And the other interesting thing about cholera is that this is a pathogen that actually lives in our environment. And so therefore, anytime you have a natural disaster, such as a flood or an earthquake or a tsunami, or if you have civil unrest, conflict, war, cholera is actually one of the first diseases that you see. And this is what we saw in Haiti a few years ago. This is what we now see in places like Syria, in Yemen, in Somalia, and in Nepal that just had an earthquake. So this is a very deadly disease that spreads very easily. The good news is that we have good vaccines available, and we need to use those more effectively. Now, having presented a little bit on the unmet need and the burden of diseases, let's talk a little bit about the barriers and the challenges. And I'll just start off by showing a list of barriers that have been known to vaccine administrators, and there's a large number of reasons as to why immunization coverages in developing countries have traditionally been low. But I'll point your attention to the top 2 or 3 reasons, which are at the top of the graph here. And really what you see at the very top is the problem or the barrier that there is limited awareness and misunderstanding. So people don't understand, people living in poor societies, in rural settings, don't quite understand exactly what vaccines are, what are the benefits, and what are the risks of not immunizing your children with vaccines. And that is really by far the biggest challenge. And then progressively, as you go further down the list, you see limited resources, you see lack of infrastructure, lack of surveillance data, and at the very bottom then an issue that vaccination is often not integrated into medical care practice. So all of these issues combined create some barriers in terms of vaccine coverage. We can talk a little bit also about challenges in vaccine delivery, and there's a very large number of points mentioned here, and I'll just very quickly touch on them. So we begin with high prices of new vaccines, the fact that a lot of these vaccines are actually not affordable to most public health programs. We can talk about the geographies and how many of the rural populations live in very isolated areas. So therefore, distribution and delivery becomes an effect, a lot of wastage that happens. We don't have adequate R&D for vaccines that are better adapted to the needs of the developing countries. We have limited buying power because income levels are low. We have cost issues. We have weak healthcare systems. We have limited capacity for cold chain. And ultimately, the confidence in vaccines is not high because people don't quite understand the value, and they don't quite understand what are the risks if one does not actually immunize themselves and their children. So this is a set of challenges. If you ask the question, what can we do to fill the gap in terms of the supply of vaccines? In countries like India, we actually have a pretty good system in place when it comes to storage capacity. At a national level, we have a very large number of cold chain storage points, more than 27,000. We have good infrastructure. Now, where we are lacking a little bit is in maintenance. A number of our supply chain points are not well maintained, and so there's an issue there. Vaccine management is an issue. Distribution is a challenge, particularly when you're talking about a very large country like India, which is not only big, but also is very heterogeneous. And there is people living in very, very rural and remote areas. So therefore, distribution and delivery of vaccines becomes a challenge. And ultimately also the systems and procedures for maintaining or managing the stocks are effective, but in the next slide will tell you a little bit about what happens when we actually add more vaccines or new vaccines into the system. So what's been happening, of course, over the last several years is that in addition to the existing vaccines that we have in our systems, we are actually adding new vaccines. And each year there are new recommendations made by the WHO, and new vaccines are being added. We did this in India also a few years back with the addition of vaccines like rotavirus and pneumococcal conjugate vaccine. And what this does is that the supply chain that I just described a minute ago, which is quite good in countries like India, but it suddenly begins to undergo a lot of pressure and a lot of stress. And this is where things become problematic. So it just becomes a question of how do we deliver on existing vaccines, but can we actually bring more vaccines into the system? And that's not such a straightforward thing. So how do we improve the immunization coverage? Obviously, this is a complex question and a complex task. But there is a few things that we as a set of stakeholders can do to address this issue. First and foremost, we can do more to drive the demand. for vaccination by improving the awareness and the education and the outreach on the value of vaccines. Unfortunately, there continue to be a few myths that exist about vaccines in certain societies, and we can do more to correct those myths. We can improve access to all vaccines and ensure that supply and delivery is good by improving our infrastructure. We can work on tracking and monitoring on the demand and supply so that we don't end up in situations where suddenly there's an outbreak of a disease somewhere and we don't quite have adequate supply of vaccine, even though there might actually be vaccines available, but there's a gap in the supply chain. We can do more to improve the systems that are systems-based intervention to eliminate missed opportunities to vaccinate. And finally, we can create collaborative models between providers and public-private partnerships to facilitate and promote immunization. So there's really a number of things that we can do as a set of stakeholders and as a community to improve the vaccination coverage. When it comes to solutions for better access to immunization, there are some additional considerations that I'd like to touch on. First thing I'd like to say is that we as a country, we as a community need to invest more in R&D. We have the benefit that global charities and philanthropy such as the Gates Foundation have invested literally hundreds of millions and indeed billions of dollars in the R&D for new vaccines, and that's a very commendable effort, and it's a very, very significant effort. But we need more. We need governments to actually do this. We need societies to do this. We need other stakeholders to do this because it's not possible for a single entity, a single charity or a philanthropy, no matter how much money they might have, to address all of the R&D needs and the gaps that we have. In addition to that, we also need new strategies. There's a variety of new procurement and supply strategies that need to be explored. And one of the most developed is the advanced purchase contract, which has actually worked quite well for certain vaccines, such as the pneumococcal conjugate vaccine. It has allowed the prices of these vaccines to come down through the use of advanced purchase contracts. And finally, we need to invest in development and introduction of newer vaccines. And I mentioned this earlier, and I'll say it again, that in some cases, such as the hepatitis B vaccine, unfortunately, it has taken as much as 20 years for this vaccine to reach the developing world once it was introduced in the developed world. Now we are seeing that this gap is actually reducing, certainly with rotavirus and also with pneumococcal conjugate vaccines. We have seen introduction, which has been sooner, and we need more of that because there are newer and newer vaccines that are actually becoming available. In the final minutes, I'll just quickly introduce my organization, that is Helaman Labs, and about what we are doing and how we are trying to address this gap in vaccine immunization and what are we doing in terms of some of our initiatives. So Helaman Labs, we are a global vaccine research and development organization. We are focused on developing affordable vaccines for global health. And we do this in two ways. The first is that we take existing vaccines and we adapt them, we engineer them, we optimize them, we make them more suitable for the needs of the developing world. And the second is that we work on new vaccines in areas where there are no existing vaccines. We act as a catalyst. We are a product-focused company. We use new technologies, we use innovation to bring novel vaccine products to the market. And it is important for us to use a collaborative model to do this, and that's how we actually work. So our focus is to innovate, to optimize, to provide more access, to make the vaccines more affordable, and to make them available to the most poor communities around the world. At the moment, Helaman Labs is working on a handful of different vaccines for small children and is also for adults. Our focus is actually on enteric diarrheal diseases, but we're also working on other diseases. In the enteric diarrheal disease area, we have development of Heatstable rotavirus vaccine, which is currently undergoing clinical trials. We also have an oral cholera vaccine, which is a very affordable vaccine that is also undergoing clinical development. In addition to that, we have vaccine development in areas where at the moment there are no approved vaccines anywhere in the world, and that's for diseases such as Shigella and diarrhea caused by ETEC. And we're doing this as collaborations. Our Shigella vaccine is a collaboration with NICED in Kolkata and with ICMR, and our ETEC vaccine is a collaboration with the Sanger Institute in the UK. Finally, we are also working on a meningitis vaccine. This is a pentavalent meningococcal ACYWX conjugate vaccine, which we're developing as a low-cost vaccine for treatment of invasive meningococcal disease. So at Helaman Labs, we use innovation, we use technology to develop affordable vaccines. We're working on enteric diarrheal disease vaccines, but also vaccines for other indications. And we do this in a partnership because our goal in the end is to develop vaccines for global health. And we think we cannot do it alone, we need to do it together. And we think that vaccines are the biggest intervention that a society can provide to protect the health and the welfare of its citizens. And this is a unique opportunity, and we feel that this week being the Immunization Week, World Immunization Week, there's no better message than this to communicate to the global community that vaccines are safe, vaccines are effective, vaccines are necessary. We need to embrace them, and we need to find ways to make them more affordable and more accessible to the poorest people living around the world. With that, I would like to thank you for your attention and your participation and open this webinar up for questions. Thank you.
So moving to questions. The first question is from Vibhu. He's referring to the slide 5. His question is, do you think this calls for involvement of or better coordination between manufacturers and government agencies, as well as for increasing the vaccine reach?
Yes, without a doubt. I think this is an excellent question. I think that the coordination between manufacturers and government agencies is extremely important. And I think what's important to recognize what each of those parties brings to the table. Now, what vaccine manufacturers are good at, of course, is all the know-how, all the technology, the scale, and the expertise from the clinical, regulatory, manufacturing side. And that's the expertise that they bring to the table. Vaccination is a public health issue, and ultimately the responsibility for that, although it's everyone's responsibility, but in the end, the lion's share of that responsibility falls on the government. So in terms of policy, in terms of incentives, in terms of infrastructure, in terms of priorities, those are things that the government has to set. So I think that in this case, it's an ideal partnership in which industry and government needs to go hand in hand. And I think that both shareholders, both stakeholders need to take input from each other. And I think that where industry seeks help from the government is improving some of the regulatory issues, improving some of the delivery aspects, making some of the procurement policies easier for them. And where the government is looking to industry is more innovation, more R&D, affordable products, high quality products, and also products that are available in sustained supply and developed for the needs of the developing countries. And that's what the government is looking for. So without a doubt, this is a partnership. It's a very important partnership. And I think we've seen some very good examples where this partnership has really worked well. But we need to see more of it.
The second question is from Shivani. How will investing in PPP help in accelerating development and introduction of new vaccines?
Well, as I just mentioned, because vaccination is such a multifaceted and a multi-stakeholder issue, I think that the public-private partnerships are really at the core of not just the innovation at the front end, at the R&D end, but also at the delivery end. When we have a set of emerging diseases, and over the last many years, we have seen a whole host of issues that have emerged, not just things like dengue, but also Zika, Ebola, and so many others. When these things happen, it becomes a bit of an issue in terms of who really takes the lead and who actually takes the makes the effort to make sure that there is some type of a solution, public health solution that's available. I strongly feel that if we invest more in public-private partnerships, if we create the right funding models, and if we create the right incentives, then that investment in public-private partnerships will not only help to ensure that our existing vaccines are being utilized and are being implemented in the best possible way, but it will also ensure that when we are confronted with new and emerging epidemics, that we are prepared. And that can only be done through incentivization, funding, and policy decisions to ensure that we have a thriving public-private partnership model, because ultimately, given the complexity of the problem, that's really the only way it will work. So that incentivization and resourcing is actually quite important.
Next question is from Shreya. How is Helaman's rotavirus vaccine different from existing one? Why do we need a new one?
Good question, thank you. Helaman's rotavirus vaccine is different from existing vaccines in many ways. First and foremost, this is a rotavirus vaccine which is completely heat stable. The heat stability of this profile of this vaccine is so strong that it has the potential to be completely kept out of the cold chain. And as I just mentioned, that the cold chain capacity and cold chain distribution becomes a huge problem in developing countries, and our vaccine actually offers that. Secondly, this is a very affordable vaccine, and it is something that is safe, and also it is very designed in a way that it's very easy to store and very easy to deliver. And so when you look at a country like India, which has a birth cohort of 27 million children, so in India, you have one child that is born every 1.2 seconds. You look at the challenge in terms of making sure that all of these children are vaccinated. You talk about rotavirus vaccination. It's a huge, huge burden. So if you have a vaccine product which doesn't require any complicated storage, complicated distribution, it is safe, it's affordable, it's easy to administer, you can imagine that the delivery of such a vaccine product becomes so much easier, so much effective. And that's what Helaman Labs' Heatstable rotavirus vaccine brings to the global vaccination community. And as someone very famously said, vaccines do not save lives, vaccination does. And Helaman's Heatstable rotavirus vaccine is designed exactly to do that. It's designed to increase the use of vaccination because of the way it is actually designed and the way it's optimized. And so in that respect, it's quite unique and quite different from the other vaccines that are available in the public health community.
Next question is from Harsh. How will heat-stable vaccine help? Isn't it a deviation from vaccine development R&D?
No, it's not a deviation at all, because one of the unique things about vaccines is that these are very, very complex medicines. They're very different from traditional medicines that you take. So their manufacture is complex, but even once they are manufactured, they have to be stored in a very unique way. So most vaccines have to be kept in the fridge, in a cold condition or a cold environment. Anywhere between 2 Celsius to 8 Celsius, that's the environment. If you take it out of that environment, these vaccines actually lose their potency. So actually designing a vaccine or optimizing a vaccine to become stable to heat is a very, very important consideration, because you can imagine that there are parts of India where there are no fridges, there's no refrigeration, there's no cold storage, there's no electricity, there's no maintenance, there's no training. So imagine a product that you don't have to keep in those types of conditions. You can actually carry it with you, and you can go to all the different rural areas, you can go to urban slums, and you can provide this vaccine quite easily to children. And think about the impact that that makes, both in terms of access, but also the savings in the costs associated with delivery. So designing vaccines to be stable against heat is a very, very important consideration. And it's something that we are doing with not just the heat-stable rotavirus vaccine, but we are applying our heat-stable technology to other vaccines that I talked about also. That includes the vaccines for cholera, Shigella, ETEC, and the meningitis vaccine.
Next question from Sonal. We all know vaccines save millions of lives, yet you mentioned that immunization infrastructure remains insignificantly underfunded. Why is it so?
There are many reasons for that. I think one of the reasons is the policy and the priority. I think that vaccines and immunization, unfortunately, are not always at the top of the priority of the policy makers and the decision makers. And I think that if there was more emphasis on vaccines and immunization, there would be more resources, more money that would be allocated. And I think the good news is that in recent years, we have seen a change in that trend, but I think more needs to be done. I think the other issue, of course, is that as time goes by, we have more innovative vaccines that are being made available. So with the introduction of each vaccine, the existing system becomes more and more burdened. So unless we maintain our existing system or unless we expand upon it, the addition of new vaccines becomes a problem. And finally, what I would say is that in recent years, we have also seen an outbreak of diseases that we had never heard of before, things like Ebola, things like Zika, and others. So we are living in times where even though countries have existing infrastructure, that infrastructure is already under a lot of pressure. And in addition to that, we're seeing new and emerging diseases. So if you put it all together, it becomes quite obvious that the priority for vaccines and immunization must be high, and it must be in the focus, and policymakers should keep this in mind when they make decisions on the types of resources and the budgets and the allocation that is made.
Next question is from Dinesh. As per my experience to vaccination program in India, the most challenging to acceptance by community due to AEFI drop rate are so high for vaccination, how we can overcome through new technologies.
Yeah, so I think that this is an area where there are some technologies that could be very helpful. I think at a broad level, I think that we just need to do a better job in terms of creating awareness and advocacy in the safety of vaccines and the importance of vaccines, and also to dispel some of the myths. I think at a broad level that becomes very, very important, because sometimes it is misinformation that creates a lot of problems. So we just need to do a better job at that. But I think in a country like India, I would say that we have mobile phone technology that is extremely powerful and it's extremely helpful. This is a country that is moving more and more towards the digital age, and we have seen how in many facets of our life we're moving away from our traditional approaches of transaction to digital approaches. I see no reason why those technologies could not be implemented to create more awareness and to educate people, and even to track simple things like whether a child has missed her dose of vaccination. much of this can also be addressed through mobile technology. I think we need to invest more in these types of technologies, because this is something that even the poorest man in India has access to in some ways. And I think if we do that, then on the one hand, we can create more awareness, we can create more advocacy, but on the other hand, we can also make sure that those people that actually do enroll in national immunization programs don't drop out, that those dropout rates can be controlled and they can be minimized. Because in vaccination, what's important is that until and unless a child gets the full course of vaccination, either a 2-dose or a 3-dose or a follow-up dose, the protection offered by the vaccine is not complete. So that becomes really, really important. So I think there are some existing technologies that can be brought in to make a difference and to help address this problem.
Next question is from Tarun. According to you, how government can fast-track development of vaccine in epidemic situation?
Yes, that's a good question. I think that the government can obviously do a number of different things. The government has a lot of resources available to it. I would say that to start off, what the government needs is a framework or a policy around preparedness. We need to have a clear set of guidelines that if this country faces a new epidemic or a new outbreak, what is our preparedness program? What are the guidelines? What are the policies? What are the procedures? And is that in place, and do all the stakeholders understand that this is the framework that needs to be followed? I think the second thing is that the key points within that framework need to be funded, they need to be resourced, they need to be incentivized, and that also becomes important. The third thing, of course, is that because of who we are as a country, our geographical location, there are certain things that we are more exposed to, certain diseases that we are more exposed to than others. So even having a priority list, for example, of what are the top 5 or what are the top 10 diseases that we need to be prepared for. So having those kinds of things in place are really the necessary first step. And obviously there's much more that needs to be done. I think the good news is that at a global level, in the past 1 year, we have seen global initiatives that have been launched precisely in this direction. And I think the government can actually pick a few lessons. There's a few things we can learn from those global initiatives, and we can actually start implementing those things in our country. But what I would say is that there are a number of things that can be done. But to me, I think the primary thing that is required is really a preparedness roadmap and a framework that should we be affected by an emerging epidemic, what is the way in which we would try and address that? And without that, I think it would be very difficult for us to map out what the subsequent steps and what the details would be.
Next question is from Sampath. There are a lot of myths and misconceptions on vaccination, and even today many physicians don't promote vaccination. Even government has less priority on the vaccination. What do you suggest to address this issue?
Yes, I think the observation is correct. I do agree with the observation. This is quite true. And if you remember the slide that I showed, if I could just go back to this particular slide with the pyramid. And so this is a slide that talks about barriers to immunization. And I think that your question can be addressed in this slide. And what you see here is really at the top is this issue around patient awareness and misunderstanding about vaccines and its side effects. And so I think at a fundamental level, this is what we need to do. And oftentimes when we talk about eradication, India as a country just went through polio eradication. We were very, very successful in doing that. And being a large country, it's very difficult to accomplish something like polio eradication, and yet we did that. The problem with eradication is that until and unless you remove the disease from every pocket of our society, the problem is still not solved. And with polio, what we learned is that almost, I would say, 80% of our effort was spent in the final 20% of the population, which was most resistant, that simply did not want their children to receive the polio vaccine. And I think that one of the hallmarks of polio eradication in India was not just the fact that there was a cheap and effective vaccine available, not just because the government of India, the PMO, had made polio eradication a top priority, but we had a cohort of 2.5 lakh volunteers. We had a very large number of volunteers who actually went from village to village, place to place, pocket to pocket, house to house, educating people, addressing misunderstandings, addressing myths. And it's really when all those things came together that we as a country managed to eradicate polio. I think what we need to do is build on our success story of polio eradication and now apply that success story for eradicating additional diseases that kill our children and kill our mothers and our citizens. And I think that's what's needed. But I would say really at the top of the pyramid, the top of the problem is to create more awareness, more advocacy, clear misunderstandings, and dispel the myths associated with the use of vaccines.
Next question is from Gajendra. What are your views on putting a price cap on vaccine to stop hospital overcharging anywhere from 3,000 to 10,000 for rotavirus vaccine?
Yes, so this is obviously a big problem, and it's a problem that I think is not just found in the case of vaccines, it's also found in many other medical products. As a country, we saw what happened with stents very recently and the intervention that the government had to impose on the use of stents. I think with vaccines, I would draw your attention to the fact that the majority of the vaccination in any country, including in India, actually does not happen through private channels. The majority of the vaccination happens through public health channels, in public hospitals, community hospitals, through government schemes and government programs. So this is an area where the government actually has not only a big role, but the government has a huge control. So that's very different from private practitioners and private hospitals charging an arm and a length to deliver vaccines. So I think that in the case of vaccines, if the government can play an even bigger role in making sure that everyone receives the vaccines, then I think that the dependence of people and societies on private sources will minimize. And so therefore the incentives for physicians in private hospitals to sell vaccines at a very high price, that incentive will actually go down. So this could be one way. I think the short answer is that if the government does a better job, then the private sector will be less incentivized to try and make more money from something that ultimately the government is giving to the public anyway.
Next question is from Santanu. For pentavalent vaccine, there are few case reports have been documented. Is there any specific initiative taken to overcome the adverse events following pentavalent vaccination?
Yes, so I think that the adverse events that have been observed associated with pentavalent vaccination are very unfortunate. But I would say a couple of things in that respect. I think the first thing I would say is that pentavalent vaccine as such is extremely safe because pentavalent vaccine has been administered literally to millions, if not billions of children around the world. It's one of the most basic vaccines that is out there. So the safety profile of this vaccine is incredibly strong. Having said that, I do agree that we have observed some unfortunate incidents of death in children who have received pentavalent vaccine. I think the good news is that in most of these cases, There was quick follow-up, quick action that no more incidents, no more additional deaths occurred. In those cases where there was a fatality, the vaccination program was stopped, it was investigated, and proper action was taken if there was any negligence and things like that. So I think those things are really commendable. But what I would say is that when you're looking at pediatric populations, there are children who unfortunately are born with certain congenital conditions. And many of these children, unfortunately, no matter how hard we try, will have a fatality, and that fatality is not necessarily associated with the vaccination. So I think in the case of pentavalent, it was unfortunate that we lost those children. We should not have, but the question of whether that was associated with the vaccine or was that an underlying case or an underlying problem is not really known. I think what's important to keep in mind is that a vaccine such as pentavalent is actually a very safe vaccine, and we just need to do a better job to make sure that we screen the children appropriately. So those children who have some pre-existing conditions, that we identify those children, then make sure that things don't get worse upon administration of the vaccine.
Due to time constraint, we are taking our last question. This question is from Dr. K. Sri Selam. Is the heat-stable rotavirus interchangeable with the other existing rotavirus vaccines?
Yeah, that's a very good question. We don't know yet because we are still finishing up the clinical trials of our heat-stable vaccine. I think that there's a broader question about whether the existing rotavirus vaccines, and we know that there are already rotavirus vaccines that exist in the public health system, the broader question of whether those vaccines are interchangeable or not is being addressed. And I think that there is, at least from what we can see, what I can see, there is a good scope. There's a good potential for interchangeability. But whether that has been demonstrated yet, we don't know. We just need additional studies. And once that's done at a broader level, then I see no reason that if interchangeability has been established for existing vaccines, I see no reason why that should not be applicable to the Helaman Labs heat-stable rotavirus vaccine.